So good morning. I want to thank all of you who are participating directly and those who are tuning in online as well. And a special thank you to the terrific moms who have taken time out of their day to be part of this important conversation. By sheer coincidence, PBS last night had a very, I thought, fine 12-minute segment on childcare, and I think that it has drawn a considerable amount of attention across the country, given the fact that it is directly related to the idea of working moms trying to juggle a series of responsibilities. And I thought last night that the information that PBS gathered was very helpful to our argument. So we're attempting to discuss a matter that is always of great concern to families, but it's especially urgent at this moment: the availability of affordable, safe, quality child care. Even before the COVID-19 pandemic struck, there was a shortage of good child care across the nation. Now that we're experiencing a public health crisis coupled with an economic recession, families face even greater strains and challenges. How can parents who are working from home also care for their children who are now with them at home? How can parents return to their jobs in person if there are no child care options for their children, or if the child care they can find isn't safe or affordable? School systems across the country are announcing that they will be only providing virtual instruction during the fall semester. How can parents work either at home or in person and also help their children out during the school day? There are many possibilities, but there are also some impossible questions that are facing us. What's exceedingly clear is that until we address the child care crisis, families cannot function and the economy cannot successfully and safely reopen. Along with Appropriations Chairman Nita Lowey, I have introduced the Child Care for Economic Recovery Act, legislation that expands the availability of quality child care, helps workers return to their jobs when it's safe, and enables America's economy to safely recover from the COVID recession. That bill will be up in the House of Representatives next week, and it is almost certainly to pass. So I'm looking forward to its passage, and then I hope the Senate will take our lead, and the president would then hopefully sign it into law as well. But we're not here today just to talk about legislation. We're here to listen to the voices of real parents and to learn more about the support that they need. I'm thrilled that Congresswoman Jahana Hayes from Connecticut is able to join us today as well. Congresswoman Hayes is herself a working mom. She also previously has earned the tremendous honor of Teacher of the Year. I'm very glad to have her offer her perspective this morning as well. Many viewers are likely already familiar with Deb Perelman. Her cookbooks and food blog, Smitten Kitchen, have brought much joy and many delicious meals into folks' homes over these years. Ms. Perelman recently wrote a powerful op-ed in the Times, which I read, on the ways the U.S. economy is crushing working parents. Her words struck a chord with so many people who share her experience, and I appreciate her being with us today to speak more on that issue. I also want to welcome Julie, the mother of a 2-year-old son, who joins us from Michigan. Julie is a teacher and her husband works as well. Now, due to COVID and this crisis, we're trying and they're trying to figure out how to balance jobs while also providing their young son with the care and attention he needs. Julie, thank you for being here to share your story. We're good? Okay, so we're going to start with Deb, whose blog gets everyone eating, whose op-ed got everyone talking. Deb, welcome. Not hearing her.
Move it to Diane.
Hi, thanks for inviting me to join you today. I did not write my op-ed because I am an expert on the pandemic, epidemiology, school safety, or anything like that. I wrote the op-ed because I was frustrated that I wasn't hearing any conversation about what is going on for working parents if your kids are at home and need school. I felt that since March, parents have been in this impossible bind. We don't know whether we're supposed to be homeschooling or having a job. And we are in, it's like Sophie's choice. Am I not going to pay my rent or my mortgage this year? Am I going to lose my career and livelihood? Or are my kids just not going to have fifth grade or kindergarten? Are these no longer important? And I didn't feel like anything was addressing this. I didn't feel like there were any conversations about what this means when you have to choose between educating your kids or working. Because the fact is that one of these jobs is going to fire you first, and we know which one it is. So is it official policy that it's no longer important to educate our children? And since I wrote the piece, I have been overwhelmed with responses and emails and DMs and all of that from working parents who are just so overwhelmed and they don't know what they're going to do come September. And they are people in far worse situations than my own. They are people who are single parents and they have 3 kids and they have to work. And none of these kids have a way to get educated this year. I've heard from people who have been pushed out of their careers that they spent 10, 15 years building because they couldn't work this spring. I've heard from people who haven't been able to take promotions or have had to step back from their full-time jobs. People who, even in my own family, my husband lost his job and he doesn't really have a way to look for a new one right now because we need him home schooling our kids. We also have situations that are more complicated where we do actually have a babysitter, but she has her own school-age kids. So is she hasn't come one day since March. Like, is she supposed to not educate her kids so my kids can go to school? So we just I felt like there hasn't been a conversation about what this really means and what we're actually asking of parents. This is not on schools to reopen if it's not safe for them. This isn't, I'm not asking for magical solutions, but what I'd like to see is some protections for working parents. Can we make sure that parents don't get fired because they're supposed to be schooling their kids? I know that a couple of weeks ago, we already saw our first lawsuit of what I imagine is going to be many from a woman who said that she was fired because her kids were making too much noise during her conference calls. I feel like we're going to see this over and over again. And we don't have any good answers. I also think that in March, we were all asked as a country to stay home, and especially in New York, stay home, take care of your kids, do what's right for this country and for our public health. And we all bucked up and did it. But going into September, our 5th, 6th, and we don't know how many more months, we're going to have a lot of compassion fatigue from workplaces, where the empathy that was extended to working parents in March, who were juggling a lot, isn't going to continue. I think what we're going to see is parents being pushed out of their jobs. And we're going to have, I really feel that we are at a huge risk to lose a generation of working parents, for us to lose our livelihood. And it's not just, as you know, losing your livelihood in this country, it's losing your insurance. It's losing so many other things that are connected to our workplaces because of the audacity that we need to educate our children. So I would just love to hear some policies and some conversations about what is really going on and how we're going to go forward. Because right now, every parent I know is just absolutely freaking out about what we're going to do this fall.
Now proceed to hear from Julie.
Hi, my name is Julie Gross, and I'm a proud member of Moms Rising. And I really appreciate the chance to share my story and my family's experience with childcare. And I'm grateful to Chairman Neal. Thank you very much for having this, and Representative Hayes for holding this event, because more people need to know how families like mine are struggling without quality, affordable childcare. Until this year, I lived in Tucson with my husband and our young son. And I was an elementary teacher, and my husband works in IT. And we struggled to pay for full-time childcare for our son. But, we managed it. And then when COVID hit and everything shut down, so did the childcare program that Adam was going to. And that was a complete nightmare for my family. So, as I said, I'm a teacher, but I'm not trained in early childhood education. So I was shooting in the dark for a lot of learning activities and projects to fill Adam's day. And our daycare provided links to online learning activities, which was great, but then they were online. So there's a lot of screen time for a toddler, and we just we weren't comfortable with that at the time. So we're concerned that despite our best efforts to give him what he needs, he's still being deprived of experiences that help him socially, emotionally, and developing during this really crucial phase in his life. Look. So the strain on our family was enormous, because this is basically what work looked like right here. Suddenly trying to meet his academic needs and his social emotional needs, and trying to care for him full time, and trying to still be a teacher full time. It was really hard, and it was really stressful as well. So I wasn't able to do my job the way I wanted to, just like I wasn't able to be a mom the way I want to. And that's a terrible feeling. So this summer we moved to Michigan to be closer to family. And since my husband does IT, he can work just about anywhere, which has been great. But since we had to leave, I had to resign from my job, and that has caused a huge financial strain because I'm still between jobs. But recently I have been hired, which is great news. And the school plans to thanks. The school plans to start in September, and they plan to have in-person instruction with the social distancing, face masks, all of that. But any of that could change at any time. So the bad news with having a job and having the schools open is that we need to find Adam daycare, and there's no way my husband can do it while he's working from home. And finding anything that's going to be affordable for us is a major challenge. They're so expensive, and there's not many choices right now. They're very few and far between. So I don't know how we're going to find a spot in a program that's high quality, that does a good job protecting Adam from COVID-19. And the entire situation is terrifying. But, we have to make a choice. We don't really have a choice. I have to go back to work because we need two incomes to make ends meet. So I'm worried too that there are other parents who are returning to work, and they might not have earned sick days to stay home if somebody has the sniffles. Or I'm worried about the spread of COVID-19, because I know how fast a stomach bug or a cold or impetigo can go through a daycare. I can only imagine how fast COVID-19 is going to go through a daycare. So I'm worried that social distancing that's not going to happen with a toddler, or keeping their hands out of their face. That's not going to happen. And I'm worried about getting a slot in a program that at a time when being put on a wait list would not be a good situation for us to be in. So raising a child was not a decision that we took lightly. We calculated this, and we purposefully did this because we knew we were ready, but we didn't think it would be this hard. This is a little ridiculous. And for our society to function and to thrive, there has to be more support for families. And I hope Congress will help fund childcare in the next pandemic relief package, pass the Child Care is Essential Act, and invest in child care sector so families can find the child care they need at an affordable cost. And for us, for future generations, we need to solve that problem. So thank you very much.
Thank you, Julie. That was terrific. And now I want to recognize Congresswoman Hayes As you know, I introduced her earlier, and she has now joined the conversation. Congresswoman Hayes.
Hi, thank you, Chairman Neal. Can you hear me?
I can hear you.
I'm in like the most random place because I'm right off the floor voting. So I have all of Statuary Hall to myself right now, but there's a huge echo because we have the dome. But thank you so much for inviting me to this conversation. Listen, I love the fact that the baby would not let you speak because they remind us of who really is in charge here. And I've talked a lot about this. You know, I was a classroom teacher for 15 years, but before I was a classroom teacher, I worked at the Stork Club daycare while I was in college. And everything that you just said, I understand what that means. There is no such thing as social or physical distancing when you are talking about childcare. You know, the fact that most parents pay more than they would pay for a college education for their children in order to put them in daycare. You know, people have to choose where they live, where they work, all of their activities around keeping their children safe and keeping them in high quality, affordable childcare. Right now, I think we have a unique situation because even though most centers are closed, parents are being told that we still have to pay staff, we still have to pay employees, we still have utilities to pay. So if you want to keep your space, then you need to continue to pay your tuition, which seems like a situation that is untenable. You know, if you're not working or if families have to make these hard choices, they really also have to prepare for what that looks like when they go back to work. And I think these are all of the things that we've tried to consider in this Congress. For me, though, I always try to find the glimmer of optimism, or what is the good side of this. I'm so happy that we're having a national conversation about childcare because this is something that I've been talking about in committee since I came here. I worked with Congresswoman DeLauro and really tried to push the childcare as essential bill. So the fact that it is coming to the floor right now, because everyone is beginning to understand how fragile our economy is without shoring up our childcare sector, without making sure that providers are adequately trained and adequately supported, and that there are more childcare slots for families. So if we can find anything good that's coming out of this, it's that childcare is no longer just the issue of parents. It's a national issue where everybody understands. The fact that we couldn't have a conversation about whether or not to close schools without talking about how will children eat, the fact that we can't have a conversation about should we open schools without talking about, well, parents need to go back to work. You know, these are all of the things where had we addressed these sectors previously, we would not be in this critical situation that we're in now. So I'm happy that there's a national conversation and people understand how important it is to have programs and employment opportunities and really begin to consider the family dynamics of their employees. You know, we've had so many people who everyone thought that you can just shift and work from home. But I can tell you, I couldn't be a congresswoman and a teacher to my son. And I'm a teacher by trade. You know, I actually know how to teach, but it was impossible to legislate and be in a virtual classroom with him delivering instruction. So this idea that home is just geography and you can continue to work is also unreasonable. So I'm happy that, I mean, you guys have been elevating these conversations forever. So the fact that you've brought the nation on board to this national conversation, the fact that my colleagues, even the ones who don't have children, understand that it is incumbent upon them to begin to understand this issue because their constituents are depending on them to get it right, I think is just a unique opportunity. So I'm so happy that the chairman is, I don't think we're taking advantage of it, but just taking advantage of the opportunity to really illuminate and illustrate all of the things that we've been saying up until now, and not just talk about it or legislate about it, but to appropriate funds to make sure it happens. So thank you so much for having me here.
Thank you, Jahana. Now what we'd like to do is turn our attention to Diana.
Hi, good morning. Thank you for having me. Thank you, moms, for sharing your story. My name is Diana Lamanji, and I live in New York City. I'm a writer and a consultant for nonprofits, including Moms Rising. I'm also the mother of a 9-year-old son and 3-year-old daughter. The pandemic's impact on the childcare options have been absolutely devastating for my family. I want to thank Chairman Neal and Representative Hayes for bringing attention to this issue and the opportunity to share my story. Like many working families, my husband and I struggled to find and afford childcare when my son was born. We were lucky to find a spot at a place called My Little Footprints Daycare when he was 2.5. It had everything we needed. It was a 10-minute walk away from our home. It had great hours of operation. It provided high quality care and outdoor enrichment. And of course, the price was right, which was really important. It even had staff that was fully bilingual, which in my family is very important. My son attended My Little Footprints until he went to kindergarten. And when my daughter was born, I immediately knew that that's where I wanted her to go. So I put her on the wait list. And she started there when she was 20 months old. Over the past 7 years, the director and the teacher at My Little Footprints have become part of our family. Having the care allowed me to grow as a professional, and I knew that they were in a safe and nurturing environment, and that I could keep working the way I wanted to work. In mid-March, when the pandemic hit, our childcare center closed, and at first we thought it was only going to be for a couple of weeks, but in May we got devastating news. They decided they had to close permanently. And yeah, the owner just couldn't keep up with the rent and other expenses, without the tuition coming in. So it was a complete shock for us, as you can see. I'm still emotional about it. We thought that My Little Footprints, because it had a city universal pre-K program, that it was not in danger of closing. So it really became a shock. So in June, we had to go pick up our daughter's stuff, and that's it. So right now, we're not sure what we're going to do. It's really hard to find care in normal times. The price has to work, the hours, the location, the quality of programming, they all have to be ideal. And right now, so many centers are closing because of the pandemic that it's really hard for the ones that are open to manage because of the smaller class sizes and everything that we need to worry about because of COVID-19. All the cleaning materials and PPE, everything is draining their budgets. So not having childcare has been incredibly tough for us. It's not possible for my husband and I to work while caring for a 3-year-old and a 9-year-old. At first, we tried to stagger our schedules. We worked early nights and late nights, but that was quickly unsustainable. Being stretched so thin has taken a huge toll on our mental and physical health. Personally, I've experienced huge levels of stress that have manifested in insomnia and chest tightness. And of course, our work has suffered because we aren't as productive as work as we'd like to be, and we feel like we're not 100% there for our children, giving them the attention they need. So, we know something has to change. If we can't find access to safe, affordable childcare, I will have to significantly cut back on my consulting business, which will, of course, reduce our income. My husband works full-time, and we get our health insurance through his employer. So him stepping out of the workforce is not an option for us. So I will be the one who will have to leave the workforce or significantly cut down to take care of the children. And this issue isn't only about, childcare for my little one who's a toddler, but it's also about how we're going to handle back to school. My fellow moms have talked about it. How are we going to handle potential 100% remote learning or a staggered ABC model where, my son would go to school every few days, but be home the other days? So all families, all parents, regardless of political affiliation, we're all suffering. It's impossible to have 2 full-time working parents at home who are supposed to be working full-time and managing remote learning and, providing meals for our children and activities for our children, making sure they're safe. The scenario is, to say it's unsustainable is just putting it lightly. Like, we're drowning. That piece that Deb wrote spoke to me in so many ways. We're physically and mentally exhausted. And I say this, and I'm one of the lucky parents. I haven't lost my income. I'm not house or food insecure, and I can't imagine what that's like when you're in that situation of having lost income or healthcare or housing. So my personal experience is consistent with the research that's out there that I'm sure you've seen that says that women are going to be disproportionately pushed out of the workforce due to COVID-19. And if Congress doesn't fund childcare in the next relief package, it's going to have devastating effects for women like me who won't be able to have careers to support our families. The progress toward gender equity, of course, would stall, and our economy would suffer for many years. So I'm really hoping that more leaders in Congress will recognize that childcare in America is an emergency state, and we need to make a priority to pass the Child Care is Essential Act and to invest in the child care center so that we can finally make safe, high-quality childcare accessible to everyone. It's crucial for our nation's recovery, and it's the top priority for families like mine, and I hope that is a top priority for Congress as well. Thank you. And sorry for the tears.
Believe me, it was real. That's very important, this conversation. So you've all touched upon it, and maybe we could go into it a little bit more because you touched upon economic security as it relates to child care, your points of testimony. And I would ask you this, what, given the pandemic, would you now be looking for in a child care provider that you might not have considered before?
I know that I'm looking for safety. Number one is safety of, making sure that there's smaller class sizes, any procedures that they have that they could explain to make me feel comfortable to leave him there for 8 hours. That is something that is like number one on our priority list.
I think, Chairman, one of the things that I've been thinking about a little bit differently when we talk about safety is we know so little about the way this virus travels with children. And I think daycare centers are especially vulnerable because we have children at different ages, some who have not been immunized, some who have only started their immunizations, and many children, I have lots of friends who have small children who now their immunizations are off track because offices were closed during COVID and people missed appointments. So you have kids at all different stages of this virus. Of this journey, and we don't really know how the virus will interact with them. The other thing is, when we think of childcare, it's not just babies. There are a lot of kids who have before and after school care. So we're going to be mixing a combination of kids from different age groups in these settings. So I think it's critical that there be flexibility in any funding so that as we receive more data, we can make sure that we resource appropriately. I think that's one of the things that I've been thinking about. And then even flexibility, because if there is a second wave and parents are asked to keep their children home, we need to make sure that the centers are sustainable so that they're not closing permanently. And the answer can't be that parents are still continuing to pay tuition through those weeks or months or whatever it's going to take, because a parent shouldn't have to decide, well, I'm going to keep paying the center because I need for the space to be available when this is over, if they're not working or if they are not receiving an income. So it's a double-edged sword because it's hard on both sides. Because the parents can't afford to pay it, but the centers can't afford to stay open without those payments. So it really has to be, some opportunities for flexibility. I mean, this is one of the things that was always an issue in schools and what I keep talking about now. If a center or a school or any of these facilities puts all of their money into reopening safely, and then they have to switch gears, there is no second pot of money. So they can't do this without some support, some help from Congress. You keep talking about the Child Care is Essential bill, and I'm excited to say, will be on the floor next week. I am reading over every part of this bill because I will actually be the member to deliver the opposition, because everything is going to be brought up about why we should not pass this bill. And I know from my personal experience, from my constituents' experiences, and just from being in touch with my community, why this is essential. And this conversation with you just further supports what I already know. And really, for me, it's always easier to legislate when I have real stories and real faces of the real people who are affected. So what you are providing here today is invaluable. So thank you.
I always come to the same position. I always think that I would include as well, when you have real legislation, it's a lot easier to proceed when you actually have legislative form. So why don't we give Deb and Diana a chance to comment as well on that question, or any other issues or thoughts you want to hold forth on as it relates.
You know, in terms of, you asked what we would need to see for us to feel safe sending, for me, it's, both my kids are school age. They go to New York City public schools. I mean, if you listen to teachers, and I'm sure you guys do, they're going to tell you that before COVID, they were having trouble getting the paper towels refilled. They were having trouble getting the bathrooms cleaned. I can tell you how often my kids would come home and say one of the toilets wasn't working. I understand why teachers are terrified to go back. They said, we couldn't get enough paper towels, but suddenly we're going to have enough sinks and Purell dispensers. How is this going to work? So again, this is just exacerbated problems that we already had. But you know, this idea that, I feel like we have this idea that schools can just fix this, but we know that they can't. The funding needs to come from outside the schools. Most schools in New York City are already under budget, overfilled, understaffed. They're not going to magically be able to get 6 feet of space and enough sinks. We need to make sure that, you know, it ends up pitting parents against teachers, which is absolutely not the energy we need in this room, especially when many teachers have their own kids that they're trying to figure out how they're supposed to do this. Like, how do you teach kindergarten from your living room while you have your own kindergarten that needs it? Actually, that would be easier than having kids of different ages. So there's so many impossible situations, and we're looking at parents to fix it, and we're looking at teachers to fix it, and it's not realistic. It needs to come through funding. It needs to come through policies. It needs to come, and for me in particular, I'm concerned, as I mentioned earlier, about working parents. What protections do I have against not losing my job if I need to teach my kids school? And I want us to say the quiet parts loud, which is that if you expect us to keep our jobs this fall, you are also asking us to not teach our children. And that is, like, I think it needs to be said loud and clear that what you're saying is that my children should not be educated because I have to keep my job, or I shouldn't have an income. And I wish more people heard it, and that the actual way it feels for working parents right now. Thank you.
You described it the way you did, in a reminder that in the HEROES Act that we passed in the House 2 months and 9 days ago, there is $1 trillion that is allocated to state and local governments. And I think it would provide parents with this sense of security before they had to make the decision as to whether or not to send the child to school, as you've described it. I think that might well be the magnet that we can attach a lot of other issues to, because these states are simply out of money, and many of them have embraced 1/12 budgets. You can't do predictability and investment based upon 1/12 budgets. Diana.
So in addition to safety, like Julie mentioned, and also resources for schools, my son also goes to a New York City public school. I often think about the health of the childcare workers in daycare centers. Many of them don't have access to health insurance. And that worries me because in a time when we want them to stay home if they are sick, you know, I want them to be able to stay home if they're sick. I want them to be able to have access to healthcare, and I want them to be able to have paid sick time. And I know many small business owners aren't able to offer that to their employees. So that's something that hasn't been mentioned that I would add. And also the piece about after school, which is really important. You know, even if my son goes to school every few days, that's only, you know, from 8 to 2. There's no after school, and I don't know what that would look like. And I'm sure a lot of parents are trying to figure that piece out.
We discuss the uncertainties around healthcare recovery and economic recovery. Could you, perhaps the three, describe what this means in your own decision making? One of the things that I've tried very hard to do is to remind people that until we defeat the virus, it is going to be very uncertain as to the way we proceed. And when I hear people say, well, let's get to economic recovery, they couldn't be more correct. But we're still in a period of what I call relief and stability as we proceed to recovery. So your three of you are really on the front line of relief. And you've all made the same argument that you need some stability. Do you want to talk a little bit about that as well?
I mean, I can just say that in my own family, and again, I've tried to deflect a little bit of the energy from my situation because I feel like we live in New York City and we have a lot of privilege and we're not as hard hit by a lot of people. But if it's even this bad for my family, I can't, the way it is for the rest of the people in this country is so much worse. But even in my own family, we cannot make an economic recovery until my husband can go back to work. My husband lost his job about 5-6 weeks ago, and do we start a job search? First of all, if there was even a job out there for him with a huge amount of employment, but we've got our health insurance through his job, so we're paying for, COBRA right now, and I don't know how long this is going to go on for. So we can't get back on track until we can all get back to work, and I don't know when that's going to be. I mean, we have no idea when it's going to be, and it's not on the government to make the virus go away faster, but we can put in protections for the people being squeezed out of the workforce or people who were doing really well and are now barely breaking even.
I can add to that. I echo what Deb just said. Like I mentioned in my remarks, we haven't lost our income. We've been lucky in that way, and we're able to, continue paying for our housing and are not food insecure. But there are many families who I know in New York received a certain amount of time for example, rent freeze. And what's going to happen to all those families when all of a sudden they're being told they have to pay all this money in rent? Like, they don't have the money, right? Does that mean that we're going to have more homeless families on the street, which is going to have a devastating effect? We're already, in New York City alone, the homelessness problem it's huge. So that needs to, be taken into account. Again, food insecurity, we should be giving more people access to SNAP. We shouldn't be reducing that funding, right? So those are I think the basics. We need to just make sure that people have housing, that people have access to food, that people, have access to healthcare. I sound like a broken record, I feel, at this point, but,
In the, no, you're fine. And in the HEROES Act, Diana, we increased the SNAP allocation by 15%. And part of our interest here is we're attempting to draft the HEROES Act coming on the heels of the CARES Act. The idea was that we would also try to increase liquidity and simultaneously demand. So the extra $600 a week that people receive would help them pay rent, help them pay mortgage, but also address the sustenance issues on a daily basis while simultaneously creating demand. So it was actually, and I say to my colleagues on the Democratic caucus, you need to start the conversation when the critics start to talk about the extra $600 by reminding people you cannot quit your job to get unemployment. It doesn't work that way. You have to have been laid off. You have to have lost the job. And I think a lot of people are looking at this saying people don't want to go back to work. There's not a lot of evidence to support that. So Jahana is with us again. Jahana, do you want to talk about this a bit?
Yes, I'm sorry, I had to go vote. But I can't tell you how much I love this group, because everything, you and me are the same person, because these are all my issues. And I think that people think that because I'm a member of Congress now that these things go away, but they don't. They're actually just further exemplified, because now I have this heightened sense of responsibility to try to address these issues. But I think you hit on a terrific point, because childcare is not exclusively only about childcare. All of these things are interconnected. My second committee, outside of the Committee of Education and Labor, where my subcommittee is early childhood, elementary, and secondary education. My next committee is the Committee on Agriculture, the subcommittee on nutrition, because food security is so important to me. And I understand what it means when kids don't have nutritious meals, when school lunch programs are being cut, when WIC programs are being cut, and parents, I mean, all of these things are added expenses. And I think that we have a moral responsibility to legislate in a way that gives families some support and helps them to continue to, be productive members of society. So I understand the relationship between all of these things. So childcare is not a standalone issue. It affects, like you said, the SNAP program. It affects housing security. It affects food security. So we have to consider the totality of all of these things, that if parents can't work, then we begin to put a strain on all of these other social and community network programs. And that's the way I approach legislation. Because when people think, well, this doesn't affect me, I don't have kids, this doesn't affect me. When you start to really bring in the productivity and, like you said, food security and housing security and all the other ways that our communities will be impacted in a much larger sense if we don't put in the necessary steps right now, I think I mean, as I'm listening to you, I'm like, what she said and what she said, because everything that you're saying literally are the conversations that I'm having in both my committees, and both education, labor, and agriculture, are the conversations I'm having off of the floor. And I really am very proud of the bill that we put forward, because it is, I mean, we asked for $50 billion in child care stabilization funds. And I didn't think that that was an aspirational ask. For me, actually, I thought it was a first step, because I understand how important this segment of our economy really is, for families to continue to just support all of the other parts of their community. So hopefully, I mean, like I said, it'll be on the floor next week. And I think I can tell you that I'm more optimistic today about it passing than I might have even been 2 months ago, because everybody is impacted now. So everybody wants to have a conversation about that. And our job and your job is to really help people to truly understand why it's important right now, why we can't continue to take incremental steps. And I think that this is really the work that we've been engaged in.
Thank you. Julie, do you want to comment on this?
Yes, I was just thinking about what Deb mentioned earlier about when a working family has to choose between education or their job. Oh, and there goes the thought. I had a great thought, and then it just disappeared.
I wish the Republicans would always listen to me.
I'll come back on that if I think of it.
Well, let me raise another point that you've all kind of circled, and that is that the contagion of the pandemic also makes its way into the economy based on the testimony you've offered. If people can't pay their rents and can't pay their mortgages, that means the banks cannot afford indefinitely to carry those loans. So it makes its way into a challenge for the banks as well, and for the credit unions. So I think that, again, what we wanted to do with the CARES Act, which was a pretty good piece of legislative work, and the HEROES Act builds upon it. And our whole thought here is that the worst thing we can do right now would be to embrace complacency. So why don't we go back to you, Julie? It looks as though you retained the thought.
I did, and I wrote it down.
Good work.
I was thinking that, like Deb mentioned, when the family has to choose between education and their job, some families are choosing education and using that Family Medical Leave Act to take some time off, which then impacts the other workers that they are, have to kind of pick up their workload. So even if you don't have a child, this Child Care Act is very important, because you don't want your coworker to have to take time off to educate their kid, and then your workload becomes that much more, and we're already feeling like the workload's too much with all of this happening. So that was my thought before.
Well, it was worth waiting for. So why don't we let our panelists ask some questions or raise some additional thoughts that they might care to during this forum.
You know, one of the most frustrating things that I've been hearing since I started talking about this is just this idea like you shouldn't have had kids if you can't take care of
Oh,
them.
right.
And school isn't daycare. And honestly, I know we're all on the same page here, but the view is so retrograde and it's so tone deaf because there's so much, there's this idea like, okay, so school isn't daycare. Sure. Was I supposed to have some sort of all age daycare that I was paying for the whole time? Schools, like my kids were in school, which I am, by the way, paying taxes for, in which they are legally required to attend, just in case schools abruptly closed in the middle of the year. Like, was I supposed to? I mean, I think what people are talking about is a stay at home parent. And it sounds like what they're saying is that you should have had a parent at home doing nothing just in case your kid's school canceled. And that's great if somebody wants to stay home. But for everybody else who wanted to pursue careers, there was this idea that you couldn't pivot and magically make a career disappear because schools and daycares closed is so absurd. And it really terrifies me, the idea of these really retrograde views to use this as an excuse to redeliberate whether mothers should even be at work. And obviously, there are men who are being pushed out of work too, but we know that it's disproportionately the moms that take the career hits. And we also know that moms that leave the workforce have a really hard time getting back in when they leave to have to take care of kids for a couple of years. They don't really make an economic recovery. You talk to moms, they go from this position of being able to negotiate and choose their career path to kind of like begging to get back in the door and having to take what's offered to you. It's been really frustrating to hear that this is just considered a base level of okay to talk about this. So that's come up a lot. And again, we don't view schools as daycare, but this is the system we had. This is what we were using. And the idea that we didn't have magically like a backup plan when schools closed is crazy. That's just not realistic for people with jobs.
Well, thank you. Why don't we let our other panelists proceed, and then we'll begin to wrap up the conversation.
So I think that if the pandemic has shown anything, it's that we need a strong social safety net. I think a lot of times we don't. In the past, there's been a narrative that if you need government assistance, it's not, you're poor, it's not good, you need it because you're lazy and you don't work. And I think this has shown us, right, that anybody can be laid off, that anybody can be laid off, lose income, be a short stop from having to be kicked out of their homes and lose their health insurance. I mean, it can happen to anyone. And it's not a question of you're lazy and that's why you lost your job. It's that it can happen to anyone. And we need at least a base of a social safety net. Other countries do it. Our jobs our livelihood shouldn't be linked to our jobs only. Like the fact that our health insurance is linked to our jobs is, as we were seeing, really problematic when a global pandemic hits, right? So those are kind of the parting thoughts that I would want to leave you with. So I think that this is really a moment in time when maybe there will be political will. My hope is that, all families are suffering regardless of what your political affiliation is. So I hope we can take that moment to push some policies forward that will help working families.
That's very helpful. Julie, do you want to offer some concluding thoughts?
I've talked to a lot of people in the last month about this issue, especially with schools opening back up, and it's exhausting and it's a heated debate, and there's no right answer. And this is going to sound very broad, but just try to go with me here. I recently took Adam to the zoo, and knowing full well that we were going to wear masks and stay away and leave if it got crazy, and I loved it. I felt more safe at the zoo than I did at the grocery store, and it's because everybody was wearing a mask, and they had signs everywhere reminding you of when and where to wear a mask, and there was sanitation everywhere. And I just like the reminders, and I think that's kind of what we need right now, is a little bit more dialogue. So this is very exciting to me. We need more dialogue. We need more I don't want to say instruction on how to like do this, but we need more.
Yeah.
We need more. We need more direction, and especially with the schools opening up, we need more understanding of how it's going to work, and also with childcare, we need more understanding of how childcare is going to work in the going on in the future until this pandemic is over. And I think just having this open communication is great. This is exactly what we need.
Thank you. And the point's well taken. I think Jahana would confirm that it is harder than ever to have dialogue. It's really challenging. So why don't I let Jahana wrap up, and then I'll say a word, and thank you all. Jahana?
I'm laughing because I just got a text from my daughter, and it literally says, "I'm trying to watch your roundtable and your granddaughter keeps screaming, 'I need childcare, help me.'" Listen, I get it, and I'm trying, and I mean, your problem is my problem as well, and I think that I'm really, really trying to bring your voices into this national conversation. And the idea, I mean, I said before, this is now a national conversation. I think we all know that it always should have been, but I mean, if we're being honest, it was not perceived in such a way. So, the fact that everybody is beginning to appreciate that we can't do this without these supports. And it's not, and I think you're right, this idea that if we require government intervention, that somehow it's the fault of the people who are receiving that support. We are in the midst of a global pandemic, which no one could have planned for. You can't work your way out of this. We are in the middle of a healthcare pandemic, and there are some systemic and structural things that we need to do as a nation to make sure that we are supporting our citizens. This is not by anyone's lack of will or lack of effort or their, fortitude or being lazy. This is a virus that, has descended on our country and the world, and we are trying to navigate our way out of it. And what we need to do is, shore up different parts of our economy, different parts of our childcare sector, different parts of our academic sector to make sure that we can sustain this pandemic. But the thing is, once again, these are cracks that were always there. So we should look at this as a unique opportunity to make the attempt to close those gaps, to try and fix the problems that we've always known existed, but really not giving them the attention or the resources that they deserve. So, just know that we're in this with you, and this is a top priority both within our caucuses and in our communities. As I talk to individual members about this issue, everybody understands how important it is, and we are really going to work hard not only to get this over, passed out of the House, but to push that it gets moved through the Senate and actually signed, because we can't even have a conversation about reopening the economy without considering all of the sectors that are affected and help to support a reopening of the economy. And if I had to list the top 5, childcare would be right up there. So thank you.
Thank you, Congresswoman Hayes. And I think that she summed it up perfectly when she said, your challenge is our challenge, and we're all in this together. But that's the reality of it. And what we mean by community is a place where no one's to be left behind. So I want to thank all of you. Keep a watchful eye out next week. I'm very confident that 2 measures that you're interested in, and I'm the author of one, is they're both likely to pass the House, and then it'll be on to the Senate and hopefully to the president's desk. But next week is a seismic moment in advancing our argument. So thanks to our panelists very, very much, and thanks to Congresswoman Hayes.
Thank you.
Thank you.